precautions and don't lay out there in the middle of the day baking in the sun and getting those photo-aging changes. They creep up on you slowly, but 20 years later you look at your skin and you say, oh my gosh, what I did. The other thing that seems to affect your skin also, although I've never seen a study on it, is smoking.
Oh, okay.
Smoking also changes the way your skin looks. It affects the microvasculature, the very tiny blood vessels that are so tiny to the face. And by doing that, you also see skin changes related to smoking, say nothing of getting smoker's lines around the lips.
Okay, that's a very good point. So we know that there's changes because of the sun, photo damage, meaning the light, and also that's causing brown spots as different from tanning, spider veins, red spots, and wrinkles. What else happened? You mentioned earlier also that the volume of the skin is diminished. Can you repeat that for us? And why does the volume go down?
Yes, what happens is the skin itself actually thins. The skin has different layers, the epidermis and the dermis, and you actually find in the dermal layer, which is a layer of skin just below the surface, you actually get thinning of that entire layer and some thinning of the epidermis just related to aging changes and also sun exposure.
Okay, it's thinning. Is that because there's less moisture in the cell? What happens, what makes it thin?
Well, you'll actually lose cells, and you lose collagen and elastic fibers, and you also lose cell plumpness. And the cell plumpness is from one of the things that contributes to it is the hyaluronic acid that naturally is in the cells. As you get older, you have less of that in cells.
Okay, so you have less of hyaluronic acid, and that's a hard thing for me to say, hyaluronic acid. And also you have less cells in your epidermis, which is amazing to me. What about as you age, and do you find that the cells are rejuvenating themselves or less rejuvenating themselves?
It's interesting. As you age, things just turn over less in your skin. So if you look at a 16-year-old, 18-year-old, 12-year-old, every week they'll put a new epidermal layer, a top layer of skin, on their cells, on their face. And yet, as you get older, that skin turnover really slows down. So you go from 1 week of having fresh skin on your face to it being 4 to 8 weeks of fresh skin. So one of the reasons when you look at someone, say, middle-aged, and their skin looks a little bit older on the surface is because that young person, that teenager, is putting fresh skin down every week, whereas you're putting down fresh skin every 4 to 8 weeks. So it's a big difference.
Okay. So if I've got, my skin cells are older, I suppose that means that they're not going to look as good because they don't have the brand new look of fresh skin and everything like that. So that's obviously contributing to the aging look.
Absolutely, and that's why we do procedures such as laser procedures to tune the skin up, get new elastic fibers, get new collagen fibers, get new skin cells down.
Okay. You're talking about cell changes, skin cell changes. Do you mean that there's also changes in their actual makeup, their DNA or their genetics at all?
Well, you do get breakdown and changes in the genetics of the cells. We know that because sun exposure you get today over a certain number of years will cause damage, and eventually that's one of the things that contributes to people getting skin cancer.
I see. So the overexposure to sun can lead to the genetic changing in the skin cell, which could lead to skin cancer, melanomas, et cetera, whatever you're going to say.
Yes, oh, absolutely. And another thing is in the United States, when we drive, we sit on the left side of the car. So for most people, if you look at the skin on the left side of the face versus the right, you'll see more wrinkles, more brown spots, more irregularity on the left side than you do on the right. And that's all that sun, all those years coming through the car window.
Wow, that is definitely evidence that speaks to the fact that that exposure is not beneficial to your skin cell and your appearance.
Yes, oh, absolutely.
Okay, well, we've got a good overview that the skin ages and we know why now, but let's talk about those underlying supportive structures that you were talking about. It was fascinating to me that you're saying that your bones change. I know that many women have osteoporosis and their bones change and they can have a broken leg or a broken hip or something like that. Are you implying the same thing with the face?
I don't know if it's the same thing if you looked under the microscope in terms of the process, but we all know the facial bones get thinner, and a great example of that is where your teeth sit, structures we call the alveolar ridge, because you'll actually get thinning of the bone in the mandible, and which is the lower jaw, and the upper jaw, the maxilla, all around the teeth and dentition. And you see that because that whole area seems to sink in. And anybody looking at dental implants, they'll know that one of the first things that the oral surgeon does, or the dentist does, whoever's doing them, is gets a scan of that bone to see if it's thick enough to put the implant or if they have to put bone grafts. And the reason being that bone thins over time.
Okay, so the bone is thinning and therefore it's not as, I don't want to use, it doesn't have the same volume, but it doesn't have the same thickness, and therefore everything kind of moves in. So when people are saying it's gravity, it really isn't gravity, it's gravity plus the diminishing of your underlying structure, your bone as well.
Yeah, absolutely.
Okay. Well, I think we have a pretty interesting view of why we age and everything like that. Let's see what we can do to treat some of these things. There's two types of treatments, I presume. Our topic today is going to be facelifts without surgery, but let's just briefly go over what facelift with surgery can do for you.
Sure. A facelift is a great procedure for doing what it does, but there's a lot of things it doesn't do. So it doesn't change the way the skin looks. It doesn't restore volume. It doesn't weaken muscle-induced lines. But what it does do is for people who have loose cheeks, say down here in the jowl area particularly, or a loose upper neck, it's the best procedure for tightening that skin, for pulling that loose jowl skin up, and for tightening the upper neck. Now, sometimes when you add volume to the face, as we'll discuss under facelifts without surgery, sort of you put that in quotations, if you will, is actually adding some volume will pull all this up a little bit, because part of the reason this comes down is loss of volume. Same thing with lasers. They'll tighten the skin a little bit to pull it up, but still the best procedure to pull it up remains a facelift.
Okay. And that is a surgical procedure, and you have to go into the hospital, or do you do this?
Usually people do that procedure as an outpatient. It's a pretty standard procedure.
With anesthetic and,
exactly.
and anesthetic and a recovery period.
Exactly. But everything else we're going to talk about today can get you looking better without requiring a quote anesthetic. Just topical anesthesia will do it. And so it makes a big difference. You don't have to go to the operating room. But a facelift is still a great procedure for, for very loose jowls and for changing the upper neck. But it does involve surgery. And nowadays many people don't want to have surgical procedures.
Okay. Okay, so let's go into facelift without surgery. And we mentioned at the top of the show that there's three basic methods and procedures that you use. So let's talk about lasers that you're referring to right now. What does a laser do? Are there different types of lasers? And what specifically do you focus in to repair with a laser?
Okay, the first thing I do when someone comes into my office after we obtain their medical history is we get them to look at the mirror and show me in the mirror.
That's terrible.
I need to know what they don't like.
Oh, okay.
Because if I know what they don't like, then I need, then I have an idea what to focus on with them.
Okay.
Okay, so we're both talking about the same thing. So that with the lasers, you can treat blood vessels, aging changes, brown spots, also lines, wrinkles, roughness. And all those are changes that you see in your face. Some people really have problems with spider veins, and you can treat those well with a laser and get an immediate improvement.
Okay, let's show this picture.
I'll hold these up. This is a photo of a gentleman who came in who had notable spider veins on his nose, and you can see all those. And then here he is immediately after treatment. There's no bruising. He's a little pink, and that'll fade very quickly, 30 minutes to a few hours. But those blood vessels are now gone.
That's totally amazing. Now let's explain to our audience what lasers are. Lasers are not something that is a knife that is cutting or anything like that. Would you just give us a minute review of what a laser is?
A laser is very controlled light energy, and it's in one wavelength, uniform pulses, and so you have one wavelength, uniform pulse energy coming down, very specifically gets absorbed by certain things we call chromophores. So for example, the laser that we use for that, the chromophore, the thing that absorbs it, is what we call the hemoglobin molecule in your blood, the one that carries oxygen. So that's what absorbs it, and that's what hits the blood vessels. So it's very specific. Now the same laser is not good for everything. It's the old thing, if the only tool you have is a hammer, everything's a nail. Doesn't work for lasers. You need the right laser for the right problem. And so this laser is designed for these spider veins on the face.
Okay, so just to repeat for our audience again,